And so welcome to the Self-Sufficiency Partner Call. I am your guest host today, James Barta. And since Misha is on a well-deserved break, but I want to welcome you. And I think I wanted to jump right into our first speaker, but Sonny, I don't see you here quite yet. So, I'll move to the next item on the agenda. And that is me. So let me set things up and talk about the OEP system that we've got, and I'm going to bring up our presentation. And if you're able to put your camera on, that'd be great. I'd love to see you. But then again, while I'm presenting, it's sort of hard to follow everything. So, but I appreciate it. So not only, in my previous role, I helped facilitate this meeting, but now I'm with the Oregon Eligibility Partnership that manages the One System, and I'm the Engagement Strategies Manager there. And so I'm going to be talking about three different things today. One is the One Customer Service enhancement. So we've got a whole bunch of changes that are coming in the One System. I also want to talk about our data reporting that's now available online. And third, I'll be talking about some of the changes that we have with, we're still undergoing through the end of the COVID emergency and the public health unwinding. So the first thing is this changes in the One System. And I'm happy to report that we have a mobile app. If you go to your app store on your phone, look up, is it Oregon One Mobile, and you'll find our mobile app that has, you can see 8 different bullet points here, these 8 different things that it offers with this latest update. I don't want to go through them all because I don't have a lot of time, but I just want to highlight that you can use it like a normal smartphone, take a picture of a document and send it in for verification. That's a big deal. I'm pretty excited about. I will say that you can't go through the whole application process yet. It doesn't have that functionality, but you can create an online account. You can check your notices and check your upcoming appointments. So it's in English and Spanish, so we're pretty excited about it. And this is just some screenshots of the different screens, but same information. And I won't be sending these slides out, so you'll have the links and all that good stuff. And let me make sure. Okay. So am I? Yeah, I'm just realizing I don't think I set everything up and I didn't share my screen. Thank you pointing that out. I was just noticing that. Here we go. My apologies. Okay, yeah, I'm out of practice. What can I say? So the nifty screenshots I was just talking about for the One mobile app right here. But, and this is the 8 points. But like I said, I'll be sharing these slides and I'm going to plow on forward because I'm telling everyone else they don't have a lot of time. So I'm trying to follow my own advice when it comes to the presentations. So also in the One System, now we have text notifications. These are opt-in. You can, a program recipient will get reminders for upcoming appointments, requests for information, other such things. It's slowly coming in, but hopefully your clients that you work with will take a look. And here's something that I get to spend a bit of time with, and that is the Oregon One Online Improvement Committee. We have a group of community members, whether they're program recipients or they're representatives from community partners, that are letting us know what changes we should make to improve the One system. Pretty excited about it. We're limited each month how many changes we can make, so this group will prioritize it. So, and we're also looking for a few more people. We've had 2 meetings so far, and we had a presentation yesterday on how the One system works. But if you have experience with the One system and have some ideas to make changes in it, drop me a line. You may have noticed there's new types of notices, letters that go out to people. And Robin, I see your hand up. I'll just finish my sentence here of saying that here's a guide to let you know how to work with these notices, what's in them. We hope they're a lot better. And I want to thank people here on this call for the help in designing these new guides, these new notices, rather. Robin, do you have a question?
Hi, James. Thanks so much for taking a moment. I just had a question about your work group. Can you give us a sense of who's already attending so that folks might?
Yeah, we have a dozen people. We have some people which, I mean, it's decently diverse in terms of programs. You know, we have childcare, we have disability, we have some medical, we have a little bit of SNAP. I think we could always use some more SNAP and TANF. I mean, we're looking for people who could speak about the One system. So I'd be happy to talk with you, Robin, offline if you have some ideas.
Sure. No, just wanted to get a sense of like community members or consumers, those sorts of folks. So thank you so much for taking a moment.
Yeah, absolutely.
Okay.
All right. So talk about our dashboard and information we have there. So when you get this, you can go to the link that's up at the top, and there is a ton of information about medical redeterminations. This is basically a tool to help us figure out who's missing out. Who are we missing, whether it's a geographic region, whether it's an age, whether it's race, disability status, all sorts of different things. And it doesn't have everything, but it will have a lot. This is just the first page. There's a lot of information on these dashboards. I don't have time to play with it and demonstrate it all to you, but I'm looking forward to hearing about what you think of it and if you haven't seen it yet. And on this same web page is a dashboard of how long of the number of people going through the call center. The dark blue is the number of people who've called and gotten through, and the lighter blue is the number of people who just gave up and dropped their call. And the yellow line represents how long people are waiting. I'm just going to warn you right now, the wait times have been spiking lately this last week. A lot more people are calling. It sucks. Again, my pro tip is always call early in the morning to avoid the lines as much as possible. But right now, this week, our wait times are getting close to average of an hour. Keep in mind, people have the ability to get a call back so they don't have to sit and waste all their minutes. But it's still frustrating. It's just a confluence of factors that we knew that were coming between medical redeterminations and SNAP benefits changing. So ran through that sort of quickly, but now I want to talk about the PHE unwinding and public health emergency unwinding. Here's the history that I think everyone here knows pretty well, that people were automatically renewed for their Oregon Health Plan benefits, but there's still there's some sort of renewal process, but no one was being dropped until we started this redetermination process as mandated by the federal government. So we're beginning that process. Here's a timeline. There's a bunch of information about ABODs, about, I should say, people, adults, adults without dependents, able-bodied adults, there's the word I was looking for, without dependents. And there's some changes coming up that I know Antonio will speak to later on. But this is just an overview of some of the big changes. And this is a slice of the experience for a lot of people. Someone gets their notice, they get a reminder, they get a second reminder, and then they get a notice that you're going to lose your benefits, your Oregon health plan. They have 60 days where a grace period. And then if they don't respond, they'll lose their benefits, but they have 90 days that they can send in the necessary information and not have to reapply, go through the whole reapplication process. We're seeing, unfortunately, people being forced off the Oregon health plan, but hopefully they can go to the marketplace, different places like that. There's other things being put in, like the basic health plan and the Healthier Oregon plan too, which I won't go into right now, but Oregon, health plans are experiencing a lot of change. So to wrap up here, there's lots of resources available. If you go to this webpage, there's a whole bunch of stuff on the right side that, toolkits, FAQs, those notice guides I mentioned earlier, things like that. And, thing like a change tool, what's the experience for a common experience for someone, that's a SNAP college student. This guide can walk you through it. So that's an example of some of the resources. And and then there's, don't forget about the Need Food Guide that has all sorts of links to resources, which I know are being called upon more and more. And finally, how to stay connected with it. We have a webinar coming up next week in Spanish about PHE unwinding. Often we'll have about SNAP information. There's the link I've already talked about, the PHE partners. There's a newsletter that comes out. It's been coming out weekly. I think they're slowing it down. I'm a little fuzzy on that. There's probably people here who know that. And then finally, don't be shy about emailing our feedback team. There's a team at OHA that handles feedback, that analyzes it, that makes sure that the process gets started. If there's a change that needs to be made, there's a web form that's linked here. So we would love to hear your feedback. The team was just telling me that they need to hear from some more people about what's going on when it comes to all these policy changes around the public health emergency unwinding ending. And I think I went over my time myself. So any other questions while I stop sharing?
Hi. How about translating Ukrainian language? How about Ukrainian language?
I don't know. Does anyone on
Because
Comms team
Russian
know if that's
language-
covered? Yeah, we have Russian, I know.
You know about war or no?
Let me get back to you, Natalina. Sorry, I mangled your name, but let me see what materials we have in Ukrainian, and I'll have to get back to you, okay? That's a great question. All right, Sunny and Sarah, I want to turn it over to you guys to talk about our brand spanking new website.
Do you want to take it away,
Let me
Sarah?
Yes, let me get myself unmuted, and I'm going to, hopefully, I'm less good on Zoom than I am on Teams, so let me make sure that I can share. Let's see, I think think if I do it this way. Let me get my slideshow going. Okay, is that working? Are you seeing the big slideshow? Okay, Sunny, you tell me if I've got things going wrong. Well, hi, everybody. Thanks for letting us come today. My name is Sarah Tinker, and I work on the ODHS Web Systems team. And so, as you probably know, we did just redesign, relaunch an updated version of the ODHS website. So I want to give just sort of a quick overview of what's changed, why we made the changes, and then kind of give a demo. And maybe have a few minutes for questions. I'm not sure if I've got 10 or 15 minutes, James. I'm going to go quick. So yeah, let me know if I need to stop sooner. But at a high level, yeah, just we're going to kind of walk through these things today. And in case any of you are unfamiliar with the changes, what we did was basically launch a new version of what used to be Oregon.gov/DHS. So just the main ODHS website is what got affected by this change. So it didn't make any changes to the one site, or if you use any of these other sites, ADRC or the Home Care Commission, Health Authority, none of those were impacted. So it was just the main Oregon Department of Human Services website, which does include that benefits.oregon.gov page. So we'll talk a little bit about that as well. And our URL did change. So we're going by Oregon Department of Human Services, ODHS now. So you'll see that in the URL. Oregon.gov/ODHS is the new website. There are redirects on a lot of pages that should get people to the correct page in the new site. If there isn't a specific redirect, folks will land on our homepage where they can hopefully find what they're looking for. And there's also in our banner right now, there's a yellow banner you'll see across the top of the site that has a link to a page called Using Our Website. And that page kind of walks through how to find information. There's some tips about using the new site, and there's this button for share feedback. So if you as a partner want to share feedback with us, or if you need to update a link and aren't sure where it should go, broken links, any of those kinds of things, go ahead and fill out that form and our team will get that and we'll get back to you. Really quickly, in terms of why, the reason behind these changes, talk a little bit about the impact of the ODHS website. So our site gets over 10 million page views as a whole in a year. So that's a lot of Oregonians interacting with our site. The benefits main page that you get to when you go to benefits.oregon.gov, in 2022, that was the third most visited page across all Oregon.gov sites. I can tell you the first 2 weeks after we launched, it was the top most viewed page across the Oregon state web pages. So it gets a tremendous amount of traffic. And, as you all know, that's how people connect to get benefits, to log into one, all those kinds of things. So we really want to make that as easy as possible for folks. It's also an opportunity for us to really implement and operationalize our Equity North Star. We're focusing on being more inclusive, more language options. So it's really a way to make our website, which is kind of our front door, more welcoming to everybody, easier to use, mobile friendly, all those kinds of things. We did a lot of outreach to hear from folks that use our site. We did a user survey early on. We got about 3,500 people that filled that out. We did different kinds of online testing. Some of you may have helped with that. If you did, thank you. And we did some in-person testing in some local offices to sort of just understand the issues that people were having. This probably won't surprise anyone that on our old site, people had a hard time finding what they needed. They found it to be overwhelming, navigation not easy to use, not great on mobile. There was a lot of text. The reading level was really high across our site. So some of the things you'll notice in the new site is, it's really designed to work well on mobile. 68% of folks that come to our website are using mobile devices. So what you'll find is that everything kind of just resizes and reorients really nicely to a mobile phone or a tablet if you're using that, which is now definitely the vast majority of folks that come to our site. We're also doing a lot of work around language access. So we have actually a Spanish, manually translated Spanish version of our site. You can see here, Spanish language is definitely by far the most common other language that folks speak in Oregon. So I'll kind of show you when we look at the site how you can find that information. And then language access options across the board, just in terms of how you connect with our language access staff to get the help that you need. And ultimately some machine translation to do translation into more languages. We've also focused on plain language, starting in English, simplifying and reducing the amount of content that helps when you're doing translation into other languages. So we're really focusing on using the words our audiences use, so that it's easier for folks to actually find what they're looking for without having to understand sort of the bureaucracy of how our agency operates. Initially, I think on our old site, about 3/4 of the content was written at a college level or higher. And now we've got 3/4 is at a high school level or lower. We're generally targeting 8th grade or lower for content that's for a general audience. So we've made a lot of strides. I think we've gone from like 5% meeting that target to over 25%. So hopefully you'll notice that change when you go to our site. Priorities are accessibility, clarity, language access, mobile, and then setting standards so that we can make sure that we keep up the good work going forward, and really all focused on the user. So who's our audience and what do they need? So that's really fast kind of overview. And then I'm just going to give you a demo of some of the stuff in the new site. And if questions pop up, Sunny, if you're welcome to stop me or let me know if I should stop and show folks something. So let me move this over. Oops, wait a minute. This is where I'm bad. Let me get out of this.
Hey, at least you were sharing your page as you started your presentation.
Okay, wait, did I totally stop sharing now?
Now
Or
we
are
can
you-
see your home
Oh,
screen.
okay, you see my screen with all of my icons. Okay, wait, so let me just get let me get this over here. Okay. All right. So this is the homepage for our new site, and I'll just kind of work top to bottom. There is an option up here at the very top that lets people turn on dark mode. So that's available. That can be helpful for people with different low vision or vision issues, and some people just prefer it. There is a languages drop down that is going to be machine translation into different languages. There is a bug right now that's affecting all state websites, and this is not working. So I am waiting to find out if that's going to be fixed soon, or I might take this off until it's fixed again, because right now if you click it, it's not doing anything, which is frustrating, but ultimately that will be working. On the homepage on our site, this big search box here is sort of a custom keyword-based search. So we're able to control the results, which is really helpful because we can see the kinds of things people are searching for. So I'll give you some examples. If I type in one, it can easily get people to the one applicant portal, even though that's not on our site. That's what a lot of folks are looking for. Or if people are looking for food resources, periodic report for SNAP comes up a lot. That's in there if people start typing in periodic. So it's really targeted. SNAP, TANF, those kinds of things are all gonna pull up results, and it's based on what we can see people typing into our search. So we think this is gonna be really helpful for folks to quickly find what they need. Across the top here is sort of the main different program or buckets, I guess. We have a new office finder. So this is a cool feature where you can choose the service that you need and your area, and then you'll see results on a map. So for instance, here's different kinds of services. If I choose benefits, it's going to pull for me all the self-sufficiency offices and also the AAA, I think it's the type Bs, the ones that also provide benefit services. If I were to put in my zip code, the map is going to adjust and I can zoom in or, find office and get details for that office or get directions. So that's a feature that is a big improvement on our old site. Most of the information for folks that are seeking services is going to be under Get Help. There's different categories here. Under food cash and medical, this is where a lot of the SSP content is. I'll just show you real quick. If I say how to apply or renew, this is the new version of benefits.oregon.gov. really kind of using buttons to help people find what they're looking for. Our old site was really missing information about how to renew. So that's there. And what we can see from traffic is, these are getting a lot of traffic, apply and renew. We also have a page in Spanish now. And it also, so there's benefits.oregon.gov, and then this page in Spanish is beneficios.oregon.gov. And this is in the Spanish area of our site where you'll see a lot more content. A couple other things that are new is a page that's got information about help in your language. So this really walks through different ways people can get help by phone, in person, or getting alternate formats. The different languages, it's going to give you the different phone numbers to call in these different languages. Also a new benefits help page. So this has general information and then a series of topics you can choose from. And you basically just click on a box and it expands and gives people more information. I can tell you what people are clicking on the most is renew or reapply and SNAP periodic report. So we're kind of keeping an eye on that, and we may change the order of this just to put stuff people need the most up near the top. But so we have some ways to look at metrics and try to really make this as useful as possible for folks that are applying for benefits. Let's see, I probably need to wrap it up. Let me go back to the homepage real quick. Of course, now my computer is going to be real slow. Different categories here, and when you click on these, they expand. These are really not based around our ODHS organizational structure, but really a topic. So children, youth, and families doesn't mean child welfare. It's got stuff in here about other topics, developmental disabilities, other resources for children and youth, the ERDC program, which is now going to take people over to the early learning website, but these different main topic areas. And then the last thing I wanted to share is language access down in the footer. So there's also this information when you click on a language, I'll go ahead and choose English, but this is sort of across our agency. If you need information, this is our language access and accommodation statement. People can now call or send an email if they need help. When you click on a different language in the footer, it'll take you basically to the page that's open to that box where you can get the information in your language. So at a high level, those are some of the things that that we are focusing on. Let me just look through my list really quickly and see if there's anything else. In terms of provider resources, if you're looking for things for specific types of providers and you look under provider type, there's information in here. Agency information is going to be sort of how we operate. So if you're looking for information about DHS as an agency, for instance, you could go into About Us, Contact Us, our directory, kind of walks through all of our different program areas. So just trying to streamline, are you a person that needs services? Are you looking for information about our agency, or are you a provider or partner? And then over here, when you say site in Spanish, so from anywhere in our site, when you click on that, it's going to take you to the Spanish version of our site. So you'll see a lot more Spanish language content.
And Sarah,
Yeah.
there is a question in the chat. Martha is wondering, she says, this is great. For those of us doing advocacy and needing previous reports that have been on the old website, will those be transferred over to the new site?
It should be, yeah. If you told me specifically, I could help you find it. But most of the, we did do some cleanup of really outdated stuff. We reduced, which helps people find stuff more easily to kind of get rid of outdated content. But stuff that was current and that was on the old site should all be in the new site. It just might be in a new spot. So you're welcome to fill out that feedback form if you need help finding something. Try, go ahead and try this search, or you can, if you click the search magnifying glass, this is going to search across our whole site. So that might be a way to kind of look for things as well. So if you're looking for reports and data too, I can just show you. If you look under agency information and under data and records, there's a lot of different kinds of data here. If you say all data and research, this is going to take you into that part of our site. So I'm not sure if that's what you were getting at, but self-sufficiency program data connects to, here's the medical redeterminations in the one dashboard and different kinds of reports, et cetera. So yeah. But we'd love to hear from you. You know, as you go out and take a look, feel free to send us feedback if you like it, if you don't like it, if you can't find something. You know, it's helpful for us to hear from folks that are, you know, in the community working with folks and using the site. So thank you.
Thank you, Sarah. That was a lot.
I'm a fast talker too. That was me trying to go slow.
Well, wonderful. And we'll get these presentations out to you soon, as I said in the chat. So without further ado, we'll go to our policy teams. And Antonio, good to see you.
Hi, good afternoon, James. Thank you for inviting me. Is someone going to, are you able to share your screen? Or we don't have,
You should have a share at the bottom.
okay. 1 second.
We could use the teams here.
Okay. Are you able to see the slide?
No, not yet. Oh. There it is.
Okay, thank you. So just a really quick update. So as you know, as it was mentioned earlier in the presentation, we have started implementing the SNAP time limits based on the fact that the public health emergency ended back in May. So July is the first month that we're asking or applying the requirements to meet 80 hours of work per month, full benefits received. And so we've been notifying people. We started notifications back in April and sent second notices at the end of June. And so we've been receiving calls from individuals who received these notices, and the ABOT team has been working diligently on screening and making sure that those who shouldn't be impacted by this policy are not impacted, while those that need assistance in creating a plan get referred to our contractor OED. And so I want to make sure we review the counties. Clackamas, Deschutes, Jackson, Lane, Lynn, Marion, Multnomah, and Washington counties are the ones where individuals, if they are not exempt and or are not participating in work activities, will be receiving countable months. So every month that someone doesn't participate, they'll be getting a notice. The first two notices will tell them you've received SNAP benefits and you were required to do work activities. The third month, they will also get a notice, but they will also get a closure notice. So that's something that we expect to start happening in October. So again, it's very important we ask you that you help us communicate the message that if someone hasn't reported that they need an exemption, to let us know and call the ABOT team, email the ABOT team. Let me see. Again, the pages that James, you highlighted are filled with information regarding what the experience would be for people who have the able-bodied without dependent status. And so those are resources that we are asking people to utilize so that they can share information about what it means to have an ABOT status and what it means to, you know, who they should contact if they have questions, if they received one of the letters. So again, we sent the letters to each person that is directly impacted. We sent the notices in the language that they preferred whenever possible. And finally, there were changes that are requested by the Fiscal Responsibility Act that we wanted to highlight. They want us to start increasing the age range starting September and October again for this year. So this is information that's going to be changing. We are also allowed to use 3 new exemptions, and we got clarification from our federal partners about what the definitions are. So again, this is all I have for right now. I know I went really fast, so I was given limited time.
I mean like that. And but I think we have just a little bit of time. Thank you, Antonio. And Linda has a question.
Yes, actually, I was trying to figure out how to put it in the chat, but I just couldn't get the words to make sense to what I'm trying to say. A couple of people who got AWOD notices, I guess the notice said there's no current AWOD for you to be connected to at this time. We'll contact you later. It's been a couple months, so they like lost their SNAP. They don't seem to have a next path or next step on where they go to turn in their like status, like if they're working or doing or even how to engage in the AWOD to keep their benefits. So I was just wondering if this is like an ongoing problem or if there's another way we can
So
find out about it.
that is actually confusing because we might want to take this question offline, but no one should be losing their benefits as of yet because of this change in policy. So the work requirements start in the month of July. So that means that they have 3 months of SNAP benefits that they'll be able to get without participating. So no one should be, the system is not going to close benefits based on this new policy until October. So anyone that has lost benefits, it's not related to this change. So I want to make sure that that's clear. The other thing is that we have found out that our people are misunderstanding the notices about the other policy, which is work registration. So anyone who applies for benefits who is between the ages of 16 through 59 has to meet general work requirements if they are not exempt. But those are different. Those are different requirements, and it doesn't result in loss of benefits unless someone who is working full time or working at least 30 hours per week quits that job or decreases those hours without good cause. But again, that's a separate policy that wasn't suspended during the public health emergency period. So I think that there's a confusion as to what work registration general work requirements means and what the ABOD work requirements are. But again, we can take that question offline if there's a specific notice that was received.
Thank you.
Thank you, Linda. And once again, thank you, Antonio. I know you give a lot of these presentations, but we always appreciate it. Kirsten, good to see you. And you're here to talk about the Survivor Investment Partnership. Uh-oh, but I can't hear you. Is it an F5 thing, perhaps? Okay. Oh, wait a minute. What we can do is let you play with that a little bit and see if we can figure something out. And I'll ask Jen from our partner agency of Department of Early Learning and Care to give an update.
Yes, hello everyone. We're about week 2 into being the new Department of Early Learning and Care. And I just wanted to give a quick announcement today that we are beginning our work on the implementation of the policy to cover children for childcare, regardless of their citizenship or immigration status. Actually, this next week, we'll have some of our first design sessions specifically for the One system, but we did want to offer up a chance to engage with partners, advocates, families, childcare providers on how the implementation of this policy change is going to happen, and also on the communication plan as well. So I will pop some information in on the chat, but just wanted to put out that invitation for anyone interested. If you know someone else who is interested, go ahead and give them the contact information and they can reach out to our childcare policy email box, and then we'll have some engagement opportunities coming up in the future. And that's all.
That's great. I know the agenda said we were going to hear from TANF, but there was a delay in implementing this change that they wanted to talk about. And so we will wait until a subsequent month to hear from them. And I think Kirsten is rejoining us. I hope things work this time.
Good afternoon. Can you hear me? Yay. Sorry about that. Oh, goodness. And did I just interrupt someone else or were you ready for me? Okay, great. I am Kirsten Sands. I am program manager with Self-Sufficiency, overseeing the domestic violence survivor programs. And I'm here to give you a brief update on the Survivor Investment Partnership. The Survivor Investment Partnership has been a collaboration between the Governor's Office, ODHS, the 9 Tribes of Oregon, culturally specific domestic violence agencies, as well as our provider partners across the state. And this work resulted in a $10 million funding for 21-23. And we wanted to give you some updates on where we're at with that right now. So let me go ahead and share a slide. Hopefully I can do this on Zoom. Why is it not connecting? I'm so sorry.
No worries.
Okay. Every time I hit something, it goes away. Okay, I think we've got that. Can you see that?
Yes.
Okay, great. I'll be looking over there a little bit as I go. So we are excited to announce that as of the end of the biennium, we were successful in finalizing intergovernmental agreements with each of the 9 tribes of Oregon. We were able to do amendments with all 31 of our co-located advocacy agencies to provide survivor investment dollars. And we also were able to grant 8 culturally specific grants to domestic violence organizations across the state. And those organizations, as you see here, are Bradley Engel, Bridges Oregon, Ecumenical Ministries of Oregon, Northwest Family Services, Oasis Advocacy and Shelter, the Immigrant and Refugee Community Organization, the Harbor, and Women First Transition and Referral Center. And right now, our Office of Financial Services has either already gotten this funding to these organizations and the tribes, or is just about to do so. And so it's very exciting. And now we are working towards the next phase of this work. Now that we've gotten the funding out the door, our Survivor Investment Partnership staff are working hard with this next stage. So one of the things that we're doing right now is working with ODHS Office of Tribal Affairs in the 9 Tribes of Oregon to help them establish a Survivor Investment Partnership Tribal Coalition that will focus on the domestic violence issues, and they will be working together in this coalition to share best practices and join together. And we'll be facilitating and helping with that as it launches. We'll also be beginning work with the culturally specific grantees to develop a network for them as well and with them. Also, we're working in partnership to develop data and reporting requirements and elements that will capture both quantitative and qualitative data so that we can fully understand and illustrate the impact that these flexible funds have upon not only survivors, but the communities where they are, as well as the organizations and the tribes that are sharing these resources and developing their programs. And then as the year continues, this first year continues, we will be working on 23-25 biennium amendments as well. So kind of feels like we've given birth, like, you focus on the first 9 months, and then, you realize like this is when it starts. So we're really excited with this partnership and all the work that is being done on behalf of survivors. So thank you.
Thank you, Kirsten. Any questions?
And we'll see if I can stop sharing. There we go. Okay.
Excellent.
And I will send these slides to James so he can get them out. There's a few more that explains things. Thank you.
That'd be great. All right, and I'm realizing, well, we have a few minutes. Here we are with a little bit of time for questions or discussion. And as you think about that, I realized at the beginning, I did not ask everyone to just put in the chat your name, pronouns, organization, your role. So if you could take a moment to do that, I would really appreciate it. It'd be great to see who all is in the room, so to speak. But this is, in our hurried lives, a moment that I'd love to also hear what's going well, what's going poorly, what the state can be doing better. Any of these types of comments, I'd love to hear them. But now everyone's probably typing, so. So I guess everything is just going hunky-dory, huh? And I wasn't kidding around about if you're interested in the one system. I had about 16 people in that committee. A couple had to drop off, so I'd love to add some people, but be happy to talk offline about potential interest as well. I feel like we're ending on a similar note that we started with the intro music of John Cage playing his symphony of silence. Well, okay, I probably don't need to keep vamping then if no one else says anything else. So thank you for your work. It's nice to be with you all again. I do attend all these meetings. I just don't talk very much, but maybe it's better that way if I don't talk too much. But in any case, I really appreciate everyone's work here, and as we work for Oregonians, and feel free to reach out if you have questions, concerns. We want to hear about it, and we'll get on it as well as we can. So thank you again, and have yourselves a good Thursday.